Hello and welcome to Wellness Wednesday on Health and Horsepower. This week, I want to talk a little bit more about what a normal period looks like and talk about what some abnormal symptoms and abnormal colors can mean for your health. So, let's talk about what a normal period is. So, normal periods happen on a frequency of every 21 to 35 days of time. So, if you are having periods that are less than 21 days between or more than 35 days between, that would be considered an irregular period. Normally, your cycle should last anywhere from 2 to 7 days. Average is about 4 to 5 days for a cycle. And during a normal menstrual cycle, we should be losing anywhere between usually around 60 milliliters, which is going to be about a shot glass and a half. So if you are losing more blood during your heavy flow than a shot glass and a half, that means that you have heavy bleeding, heavy flow, and that can indicate a hormone imbalance. Most of the time I see when we have very heavy cycles, that means that we have very high estrogen comparatively to our progesterone. That can be a result of your body producing too much estrogen. It can be from estrogen that you are getting from either a birth control pill. It can be estrogen that you're being exposed to through foods or toxins in your environment. And sometimes if your liver is trying to eliminate estrogen for your digestive system, sometimes we have bacteria imbalances that can actually unlink the estrogen on its way out of the body and actually resorb it. So a lot of times your liver, while it's trying to get rid of the estrogen, because of a bacteria imbalance in the gut, that can actually be unlinked and go back into your body, and we can see high estrogen levels. Now, when we look at abnormal cycles, I mentioned already cycles that are shorter than 21 days or longer than 35 days in between. If we are having any spotting or bleeding in between menstrual cycles, that is also an indicator of irregular cycles as well, or abnormal cycles. We can also see for some women that are having very heavy flow, so again, more than a shot glass and a half during their cycle, that can mean that they're losing too much blood, and that can result in not only weakness and dizziness, but sometimes even fainting and anemia issues. So if you have anemia issues and you have a heavy menstrual flow, it's very likely that you need to get your hormones under control first in order to solve that anemia, because every single time you have a cycle, it's going to happen all over again. Another thing that we can see is some of the research has now shown that when we have irregular cycles, we're going to have abnormal ovulation patterns and abnormal ovulation timings, where you're not ovulating how you should be, or even not ovulating at all. And about 40% of fertility issues have been linked to ovulation problems. So if you are having an abnormal cycle, whether it is too short, too long, lots of heavy flow, lots of abnormal symptoms, so pain, clotting can be big issues. Typically, when you have a cycle, some clotting can be normal, but if you're having jelly clots or larger clots that are bigger than the size of a quarter, that can indicate that we have an issue where basically our body is sloughing off too much at once. And that can mean that, again, we could have high estrogen levels causing that lining to come out in chunks. So really when it comes down to it, I always like to kind of give some indicators as to what your body's trying to tell you. So typically as we look through a normal menstrual cycle, so you have your actual bleeding days, which is going to be day one as the start of bleeding is the day one of your cycle. Typically when we get about halfway through menstrual cycle time when your body is ovulating, you may see some discharge or even notice some smells that are coming out of the vaginal canal, and those can indicate a healthy environment. It is normal to have discharge, whether it be white or clear in color, completely normal, not gross. That's what it's supposed to be like. You may also notice sometimes that your underwear bleached to more of a white color, especially if you're using colored underwear or patterned underwear. And that as a result of the vaginal fluid is actually acidic. So it does actually kind of bleach some of your underwear. So if you're noticing some color changes, that is actually a good sign that you have a healthy environment in your vaginal canal. Now, when we get into an actual menstrual cycle and the colors that come out, there's a couple different ones I want to cover. So light pink typically is an indicator that we have a very light flow. Now, if you have light pink throughout, that means that your body may not be building up that lining enough, or it's not escaping through the cervix during your menstrual cycle properly. A lot of times, I have had some women that have had issues with some nutritional deficiencies, as well as hormone imbalances where they start their cycle with a brownish or a very dark color. And that can indicate that we have old blood. Normally, when you are starting your cycle, it is normal to have like a lighter pink to start, turning into a brighter red. But if you are starting with a light pink and moving into a dark brown, that means that blood has been in there since your last menstrual cycle and it's not emptying properly. So typically light pink is more lighter flow, can be normal at the beginning or the end of your cycle. Bright red is what we should see at the beginning of our cycle. So typically the first 1, 2, 3 days. And then a lot of times you'll start noticing some color change near the end of your menstrual cycle. If you are having very heavy flow, that bright red color indicates that you're having heavy flow. But if it starts to turn darker in color, like a purple or a brown, that can indicate that, again, you can have some leftover blood that wasn't fully evacuated out of the uterus in your last cycle. Another color we can see is like an orange color or a green or even a gray color. And those are colors that can indicate that we have either some fluid that's escaping with it, or sometimes we have exudate that is a result of an infection. So anytime you're seeing colors like orange or yellow or green or gray, those are not good indicators. Those means we have some type of issue going on. That can be an infection, that can be bacterial vaginosis, especially if you're having a smell with it. That is something that we need to get checked out immediately. Another thing, I already mentioned clotting as well, but if we have more of a jelly clot that's coming out, if it's larger than the size of a quarter, that can mean we have some abnormal things going on as well. So a normal cycle, again, is between 21 and 35 days. We should have 2 to 7 days of bleeding. We want to make sure if we are having very heavy bleeding, so soaking through a pad in less than 2 hours or a tampon in less than 2 hours, especially if that's happening quite frequently, we want to make sure we're not losing more than a shot glass and a half of blood during our menstrual cycle. And if you're losing more than that, that means that we have heavy bleeding and potentially some hormone balance issues going on. We should also not see symptoms of whole entire body pain, back pain, a lot of cramping and clotting and things like that can also indicate that there might be some other issues going on. Typically, hormone imbalance can cause joint pain. So a lot of times around ovulation, if you're having some symptoms of back pain or headaches, that can be indicators there might be something going on with your hormones are being off balance. If we're seeing that at the start of our period, again, same thing, that can mean that we have some hormone imbalances going on. So if you are wanting to know more about what a normal period looks like or what you can do without needing medication, without needing IUDs, we have a free workshop we're offering right now. You can go on our website, freedompeoria.org, and there's a button at the top of that page to click and sign yourselves up for that workshop. It's free of charge. I want to make sure people are knowing what a normal period is, but also what is going on and what their body's trying to tell them so they can take steps to avoid the need for birth control to control period symptoms. Because a lot of times when we're putting birth control in the mix of an already imbalanced hormone system, that's going to cause our symptoms to not necessarily improve, but a lot of times can cover up some of the symptoms, or in some cases, delay and cause issues later on down the line when you do get off birth control or have a desire that maybe you want to have kids. Your body may not have actually been ovulating properly, and it's going to be very hard for it to start back up, especially if you've been on that for a long period of time. So if you want some more information, check out our website, freedompeoria.org, to sign up for that free hormone workshop, or you can also schedule a consultation in our office where we can sit down either one-on-one or virtually and talk a little bit more about how we can work together to get some answers for you and actually get results that are not relying on medications or surgeries or any of the insertable type of controls that they have out there. There's many different things, everything from IUDs to, they also have these bars that they can put underneath your skin as well. They have some pretty heavy duty side effects, and like I said, long-term use, really not something I recommend. We want to get control and understand what's going on with our body and what it's trying to tell us. So if you want help with that, that is absolutely what I do in my office. So check out our website, freedompeoria.org. You can sign up for that free workshop or set up a consultation with me one-on-one, and we can talk about what's going on and maybe even order some testing to get you answers so that we know what's happening and we know how to get you better faster and get you results. Have a great rest of your day, and don't forget, check out our website, freedompeoria.org.